Hey y'all, it's me, Angelina DM Trailz. I'm an undocumented Latinx drag queen here in Houston, Texas. You may know me from my Wednesday show, Millennial Dolls at JR's Houston, or Sunday Drag Brunch here at Barbo M, or anywhere around the city of Houston. Today, I teamed up with NASA to talk with Elia Chino, founder and executive director of community-based organization FLOSS, about ending the HIV epidemic in the US and how our local health departments can more effectively work with our club, nightlife, and Latinx community. Hello, how are you?
I'm doing fine.
We made it.
I'm doing tired, but I'm here.
Yes, we're tired. We were at the pageant last night. But yes, we woke up, we got ready. I am so excited to get to know you because I've heard so much about you and FLAS and the organization. Can you tell me about FLAS and yourself?
What I can tell you about myself is that I'm from Mexico. I coming from a little village called Agua Blanca, municipio de La Huacana, Michoacán, Mexico.
Wow.
And I coming from a big family, very poor big family. And I immigrated to this country in 1984.
84?
Yes.
Oh my God.
That means I live in here for almost 37 years.
I wasn't born yet.
No.
Oh my goodness.
And I just discovered that I come in here for a purpose, you know. And my purpose was to helping people to save lives. That is this. I discovered this after see many people dying from complications of AIDS early in the 90s. And that's when I start taking action. And I say I need to do something about it because on those days, we have to bury 3-5 people per week.
Oh my God.
And I was hanging out with friends that I know, people that I know in the clubs, okay. And 2-3 months later, they already was dying. And they was dying with friends, by less with the family. Because the stigma, the fear, the discrimination, the phobia to talking about the subject. And my best friend, they died from this disease, from the pandemic. And I don't have the opportunity to be with them. And when the families after they died, years, 2, 3, 4 years later, they talking about it. I say, well, it really hurt me so bad because it was really my best friends. And I say, well, I need to do something about it. And that's when I started, you know, first to be a volunteer for AIDS Foundation Houston.
Oh my goodness. But now it's so crazy to me. How long has it been? 20, 30 years?
Over 30 years, 33 years.
I just want to bring it up really quickly
40,
about the
40
years already.
Yes,
Oh my God.
40 already, yes. This year was the 40th anniversary when the first case number was identified in San Francisco.
In San Francisco.
In 1981.
And we've been fighting for 40 years
for
this
40
virus.
years, yes.
I'm not a scientist. I don't know how different viruses work, but it's been 40 years and we're barely to the point where we're about to get vaccines once a month for HIV instead of getting on PrEP every day. I mean, we're about to launch those out, but it's just crazy to me that 40 years, and especially in a different pandemic, it took less than a year. It makes you question, like, do they really care about us? What's going on? And thankfully, there's programs now that they give me free PrEP. I'm under Gilead program.
Yeah, right now it's still.
Yeah.
But I think they're going to take it
Oh,
out
they're trying to take
next
stuff
year.
out.
Yes.
Yeah, but
Because people, they abuse it. The system, the health system, and charge so much, you know.
yeah, it sucks because there's people that need that medicine.
They just screw up. And who is going to lose? Our community. That one is really, really very emotionally. And almost most of the time when I'm talking about this, it's still breaking my heart. It's not easy to see people that are dying in your arms and that you can do nothing about it. And to see all these beds with people that are breathing with machines. But you know what? All these people, that's the ones give me the strength, give me the energies, and, and made me hungry to continue fighting and helping the community, educate the community about HIV. Because it's a disease that is here, it's a pandemic, it's still, too many people continue contracting HIV. And it's a lot of things that we need to be done, okay? We try to end the HIV epidemic in the United States, but that it will take a lot of work that needs to be done, and it will take it a lot of responsibilities from the society and across the government and the community and other services providers. And also the schools play a very important role, because I think the schools, they need to get involved in this topic. But I remember when we asked to go to the schools to talking about HIV, well, you can come and talking about HIV, but you cannot talking about condoms.
Oh my God.
It's like you was giving information, but incomplete information.
Incomplete information, yeah.
The more important part, because sex is one of the
main reasons.
That the HIV transmission, unprotected sex.
Unprotected sex.
And they don't want to talking about the teenagers, and they already having sex. I was on the streets and the bars and cantinas, discotheques, nightclubs, in the middle of the night, 12 to 5 a.m. in the morning, passing out condoms and literature. But the sad that you was giving the information and you see how people, they just throw out. It's very sad to see that, giving the condoms and also do the same thing. And then many times I acted, I was doing the outreach. I had to go and do in the parking lot and see all the literature, like a trash, and also the condoms on the floor, yes. But I say, you know what? If one person is taking this information, I saving one life. This person, he will get the information and maybe educate his family or their partner.
Thank you so much for that. I'm sure you have saved many lives, and you're still doing that. So thank you so much for that. Oh my goodness. I was trying to hold back my tears because
I was holding too. It's really...
It's a lot, and we have so much work to do still. And other than the fact that maybe people are not in the hospital as often anymore for complications, or as many people, a lot of things still haven't changed. Thankfully, now we have medication to live with HIV. And, being undetectable means being untransmittable, so good. But still, just because that it's still going on, we still need to be wearing condoms and stuff like that. What other type of discrimination have you faced from if you don't mind me asking, especially from your own Latin people, and homophobia or transphobia or anything, especially in the clubs? Have you faced anything?
I've been discriminated in clubs. I've been discriminated in primary care services. I've been discriminated by my own family. I've been discriminated by my church. This is
the church
from all.
Where they're supposed to love everybody.
I'm born for a Christian family. And I was punishment from my parents. But I never put attention. I was continue to do whatever I supposed to do. And I proved them that God loves everybody the same way. And I proved them with the good things that I've been able to do for the community. And I'm thankful every day and grateful for all the things that God has been giving me, all the strength, all the blessings, and all the love. My heart is full of love, okay? And I want to do nothing back to nobody. If somebody is doing something bad, I always do something good for them.